So welcome everyone. So we're going to talk about blood flow restricted exercise. Does anyone of you have you heard of this? Oh, great. I know one in here who is doing this type of exercise. Anyone else who has tried it? Okay.
I've done it.
Sorry?
I've done it.
You've done it. Okay. Or would you be okay to share your experience with the others?
I had a question first for you.
Yeah.
Is there someone in Europe that actually certifies people in this technique, or how did you learn it?
Actually, I haven't learned it. I've only gone over the literature on how to do this and the studies.
A little background here in the U.S. There's only one person I'm aware of that actually trains physical therapists and thing in this technique. This guy named Johnny Owens out of Texas. And he's developed this technique and sells this nice little machine that measures your occlusion and also blood flow and the pressures and things like that. I approached physical therapy in this area probably 2 years ago trying to do this because at the university levels, in the athletic departments, they've been doing this for years. That's where it really started here, is in the athletic departments. Yeah. Louisville has them, UK has them. But basically, here locally, at least around Lexington area, Court Physical Therapy certified a couple of their physical therapists, and Bluegrass Orthopedics has started certifying some. There are people from Dayton, Ohio that have been certified, but it's pretty rare for the physical therapy group, but I think they're kind of catching on.
Yeah.
The best thing about restricted blood flow is that you can go in, it's very efficient. You can go in and work for an hour, target specific muscles. You can wear that muscle totally out using a very low load with repetition, and you don't hurt. You've worn the muscle out, yes, but it gives you a total workout. That muscle recovers pretty quick with just a little rest. And it's just much more efficient, it doesn't hurt. And we did a couple of studies, like at the beginning, how many times could I get out of a chair in 30 seconds? I could do 3 with arms. At the end of 1 month, I could do 8. 6-minute walk, I didn't show any difference in the length. And I commented to the physical therapist, I think it's more my gait, because I'm so conscious about falling. I'm just going to go so fast, and that's just it. But I did tell her I felt better. I could go longer. So I do think it really does help to do this. I think it's an up-and-coming thing, and I think it has a lot of benefit. But you do want to get someone that's got some experience in it, and make sure you can buy these occlusion cuffs over the internet. Amazon's got a bunch of them. But you don't want to get some that are cheap that totally cut off your blood flow.
No.
You need to kind of know what you're doing with this.
Yeah.
So my experience has been, I really like it. I think it's an up-and-coming thing, and I highly recommend it.
So you do it continuously, or?
I was only doing it twice a week.
Twice a week.
And that's probably not enough, but at the beginning, I felt like I needed 2 days to recover. I mean, just to be honest, I would walk in on my own, but I'd have to have a cane or somebody walk me out.
So what's the name of the fellow in Texas?
Yeah.
The Texas gentleman, what's his name?
Johnny Owens.
Johnny Owens, you can look up on the internet, just look up blood flow restricted exercise and type his name, Johnny Owens. He's out of Texas, but he...
You know where in Texas? It's a big state.
Yeah, I know. I do not, but he has training sessions all over the U.S. that people go to.
Okay.
But yeah, you Google it. You can find it.
Well, I would say this is not big in Sweden. And the studies that have been done, one has been done in Brazil by a neurologist, I think. And 2 studies, that was a case report, and then there's another case report from Denmark. And that is from the same group who did this randomized controlled trial that came up
Well, you have
this
that
year.
clinical trial out of Brazil.
Yeah.
Using this, where they showed you had 3 down factors produced that inhibit myostatin. So there's some rationale for why it might work with IBM.
Yeah, definitely. So for all of you others, we're going to just go through what happens when you to blood flow restricted training and why is the rationale, why would this work? And then I'm just gonna talk you through the studies that have been done and the results. So then we can discuss what do you think about this type of exercise. And I don't have that many slides. So in the end, I think there's going to be lots of time for questions about this type of exercise or any type of exercise perhaps. So you cut off the blood flow to the muscle that you're going to work with. So if it's going to be the quadriceps, you put a cuff around on the proximal part of your thigh. So you inflict it the same way as when you have your blood pressure done. So you inflict it, so you take away about 70% of the blood flow. And then this is kind of connected to a machine that is measuring the pressure that you inflict. So this will generate an ischemic state in the muscle. And so this will put a muscle, together with exercise, this ischemic environment will put a muscle under more metabolic stress. So it will respond in the same way that if you were doing 1 repetition maximum. You have the same, almost the same, I think it's exactly the same or even better output doing many repetitions on the lower weight as you would have if you did 1 repetition maximum. That is really high intensity resistance training. So it will put less mechanical strain on the muscle. It will have less muscle breakdown, for sure, and you will have less stress on tendons and joints. So that, I think, really is the implication in myositis. So this is really effective to increase muscle strength, but also increase the muscle fiber area. So I'm going to talk you through the studies. So one case report is from Denmark, came out last year. So this is a man with IBM. He had his diagnosis for 5 years, but he had disease symptoms for longer, which is common. So they placed a cuff on the proximal parts of the thigh and connected this to the pneumatic system, and they had a constant pressure of 100 millimeter HG. So he did leg press training, as you can see on the picture, and he did sets on about 25 repetition maximum. So he could do 25 repetitions, but not 30 or 35. So he was doing 25 repetitions to pretty much exhaustion. And that would be equal 30-35% of 1 maximal contraction. So he rested 45 seconds in between the sets, and he was doing this in cycles for 4 to 5 minutes, and the pressure was constant in the cuff. So he was encouraged to perform repetitions to exhaustion, but if he could do 15 repetitions or more easily in the second set, then during the next training session they would increase the loads a little bit. So they always wanted him to train to exhaustion. And he also did isolated quadriceps training in the quadriceps curl. Do you know what that means? So you sit on a bench and then you have a weight, and then you push the weight up and down. So in the leg press you're working both with the quadriceps, but also the gluteus muscles and also some distant parts of your legs. But here is really isolated quadriceps training. So here they kept the loads of 2.5 kilos all the time, because it was important that he could extend the knee all the way. So he had problems doing full extension of the knee, so instead of having higher loads and him not being able to extend the knee all the way, it was more important that he could move through the whole range of motion. And then they also put cuffs on the proximal part of the lower leg, just beneath the knee, and he did calf raising, so 25 repetitions per set. And this man improved his isometric max strength by 84%, which is fantastic after 12 days. However, they also measured his dynamic quadriceps strength. Do you know the difference? Isometric, so that's, so if I put a pressure here and I push my hand, you see there is no movement. So this is an isometric, static muscle action. While if I do this, up and down, so that's dynamic. So they measured this in a computerized dynamometer, both with him pressing static and with him moving up and down. And he improved his maximal speed walking for 10 meters with 19%, but there was no change in the timed up and go. Do you know what that is? So you sit on a chair, you stand up, you walk 3 meters, turn around, and sit down again. So it's a little bit of quadriceps strength, it's walking, it's balance, so it's more a physical capacity test. And then there is this study from Golano in Brazil, which came out in 2010. This is another man with inclusion body myositis, and I think the exercise protocol was quite similar, although they only trained in a leg press. So this man improved 16% in quadriceps strength, improved 60% in his timed up and go. He had a self-reported improvement in quality of life. They did muscle biopsies in this study, so they could see that his muscle fiber cross-sectional area had increased by almost 5%. And they could see on mRNA and gene expressions an increase of mechanical growth factor, for example, which indicates that he had a hypertrophy.
What was that? It indicated what?
Hypertrophy, that the muscle is growing. In IBM you have hypertrophy, so the muscles are shrinking.
Okay.
So hypertrophy, the muscles are growing. And then there is this randomized control trials which came out this year. And this was highlighted by the TMA, and they tried to get the researchers doing this study to come here and talk to you by themselves, but they were unable to be here, so that's why I was talked to. I was asked to. Which was good. You know, I had to read up a little bit on the studies. And I know both Anders Jørgensen and the senior author Louise Peterson, so I've been talking to them about this study. So they included 22 patients with IBM. Most of them were men. They were randomized to a blood flow restricted exercise group or to a non-exercising control group. In mean, they had their myositis symptoms for 8 years, and they had a mean age of 68. The inclusion criteria was that they had to be able to walk at least a shorter distance without walking assistance. If they were able, it was okay if they used a cane or a or a walker for walking longer distances, but they were not, they could not be using a wheelchair. They had a lot of exclusion criteria, such as the history of deep vein thrombosis, pulmonary embolism, or a known peripheral ischemic disease, severe heart and lung disease, or uncontrolled blood pressure. So this is one, so all these health conditions, it's very important that you have them checked out, that you're screened, so that you know that you're healthy, healthy enough to do this type of exercise. So they did leg press and isolated knee extension in this quadriceps curl. They did calf raises. They were standing up doing dorsiflexion, trying to lift the front foot. And after 4 weeks into the training program, they also added isolated knee flexion. And they exercised in 3 sets of 25 repetition maximum, and they added a 4th set 9 weeks into the 12 weeks of exercise. And the cuff was placed at the same place on the proximal thigh or the proximal lower leg, with a pressure of 110 millimeter HG. So 2 participants did not tolerate this training. So one lady, she withdrew, she had severe fatigue from the exercise. And another patient had an accidental fall, which was probably because he was exhausted in his legs. They related it to the exercise program anyway. So they didn't complete the exercise program, and they never came to follow-up assessments. There were the primary outcome of the study was self-reported physical function using a quality of life survey called SF36. It is basically what can you do, in what activities are you limited in your daily life. So there were no difference between the exercise group or the control group, and there were no improvement in this outcome within any of the groups. But they also used the IBM functional rating scale. Are you familiar with that? It's an IBM-specific questionnaire asking about limitations in daily life. So in this questionnaire, the exercise group was improved after the 12 weeks of exercise. And what is remarkable, the training group improved in quadriceps strength about almost 6%, compared to the control group, who declined in a mean of 9.2% over 3 months. And looking at both groups before and after exercise, there was no difference. But when you look at how the 2 groups developed differently over these 3 months, there was a difference. So you could see a slight increase of strength in the training group, while the control group declined almost 10%. So this change over time was statistically significant in favor for the training group. Both groups improved similarly in physical global disease activity and damage. And CK levels were unchanged in the exercise group, and they were slightly lower in the control group. And the one woman improved substantially in all measures, and she was the one with the shortest disease duration, only 17 months. But overall, this training program was well tolerated by most of the participants. So the authors discussed that there is a huge variation in exercise response within the group of IBM. But the this training had a protective effect on muscle strength, helping to minimize the long-term progression of loss in muscle function. So you can discuss if a 5% or 6% increase in muscle strength, if that is really clinically relevant or not. Did it have an impact on how they managed their daily life or walking ability? I don't know. Maybe in some, so perhaps in some patients really improved a lot, while others did not. So it's important that you look at each individual and see how that person responds to the training. And they think that the IBM functional rating scale might be a much better survey to use for patients with IBM than this ISF-36, which is a generic questionnaire that are used population-based. And they think that this reduced disease activity and damage might not have been clinically relevant. It could have been more variability between testers, between different physicians who perform the assessments of disease activity and damage. And they also discussed that this study wasn't fully powered. They needed more patients, probably about 30 in total. So this means that some of the effects that could have come out of this training this study wasn't able to capture that. And they also think that 12 weeks of exercise might have been too short. Probably 16 or 24, or how many weeks have you?
I just did 1 month.
1 month, okay.
4 weeks.
4 weeks, and you see those improvements. That's fantastic. And this was a standard blood flow restricted program, so everyone was subjected to the same lows, the same protocol. So they think that probably it might have been too strenuous for some patients, for example, those two who withdraw from the study. And they say that in the case reports, they have been more individually adapted for each patient. And they say that that is important for the next study. So really the take-home message, as I see it, is that there was no large improvement in muscle strength, that this really highlights the importance of exercising regularly to help maintain strength and function. You know, comparing to those who did not exercise, who actually declined pretty much over 3 months. And symptom and diagnosis duration, I think, is a very important factor on how much response you can expect from any exercise program. And also this, how useful is this type of exercise in a clinical setting? Is it something that you actually can do by yourself? Probably you would need to find a PT, someone who is knowledgeable in this. And might not be available for everyone. So that's a bit of a downside of this. And so further studies are needed to explore what type of BFR exercise protocol is the most efficient. And also, we need to study more what happens in the muscle with this type of exercise and other types of exercise in IBM. So, do you want to say?
Oh, thank you. I want my husband to talk about it. He knows more about it.
My wife has IBM and she's been doing blood flow. She did it last year for 30 sessions. It So 15 weeks, twice a week is a good number because it does take time for the muscles to get back, to where you're ready to go again. And what happens is it's tricking the body into building more muscle. And it's a good trick. And she, in her first 30 sessions, picked up a little more than 2 centimeters in growth in the circumference of each of her thighs.
Wow.
So they thought that wasn't much because she was the first person they'd ever worked on. It was at the University of Miami. And they don't realize that if she hadn't been doing it, she probably would have lost at least that much, and the differential was really much greater than 2 centimeters, most likely. And so I recommend that everybody try to figure out how you can find out about this. The self cuffs it's a $100 item, and the cuffs that they're using in the professional therapists are like $5,000 item. I don't think they do the same thing. Okay, we know they don't. And there's a gentleman in Florida, his name is Kevin Mills, M-I-L-L-S, in Miami Beach, Florida. I don't have his number here, but he's readily available, he's readily accessible. And he is an expert at blood flow restriction. He trained the people at the University of Miami, where Dr. Dana Ashman, our doctor, went and arranged for us to get involved. So we think that is really good, and anybody that can move, if you can move your muscles a little bit, you can do it.
Is this a one-time deal, or are they planning on bringing her back for another 30 sessions?
She's there now. She's going again. She's on 12. She's doing 12 sessions right now. She's on a 6-week follow-up. The problem is insurance. Because they cost about, in Miami it's costing about just a couple dollars less than $200 a session. Insurance, is, I don't know how you do it with insurance and physical therapy. It's not the same as other things you're doing with insurance. So to make it affordable, you want the insurance to cover it, and you have to have your doctor really advocate for you and pound them a little bit so that they know that this is something that really is going to help you. We pounded them, I've written them letters, and my wife calls them, and so finally it took about 6 months, and they granted another series. So she's in the middle of that right now. And
do you do any other exercises? I'm sorry.
Yeah, hi. I missed the very first part of your presentation, but on the blood flow restriction cuffs, I'll say, it's like, I guess it's like the cuffs you put on for measuring blood pressure or something.
Something like that. Yeah.
But can you restrict the blood flow by using a tight wrap and that kind of thing, rather than a cuff, or do you have to monitor exactly how much pressure you put on or what?
I would say you need to monitor it so that you know, because it won't work if you take off all the blood flow. And it will have less effect if you have, if you only take away 50% of the blood flow. So I think it's important that you monitor what you do.
it's a gradual thing that you do. It's 50, 55.
Okay.
Also, just to warn against trying to do like an elastic bandage type thing. I was a nurse in the OR, and we use an elastic type tourniquet sometimes on ankles and things like that. And it's been shown that they can exceed 1,000 millimeters of mercury in pressure. So there's no way of regulating a pressure if you're just wrapping something tight around your legs.
I just wanted to ask if you do any other forms of exercise.
Oh, I do, yes. I almost got the day. I do muscle strength and yoga. Muscle strength and yoga.
This is more of a physiological question, but when you, because I used to do vascular studies and everything, and anytime, you put pressure on there with the cuffs and, you stop the blood flow, eventually over time, you're going to develop collateral circulation too. So is this looking at just the femoral artery that's, increasing the blood flow once it's let go again? Or will this over time help develop collateral circulation, which in turn feed the muscle and improve?
Yeah, so this type of exercise during ischemic conditions, there is a vascular endothelial growth factor is increased, so that will actually give you more blood vessels in the muscle.
So it would develop more collateral circulation, which is what you want.
Yeah, and that happens, if you do regular exercise too.
Oh, yeah.
So we've seen that in myositis. So after intensive aerobic training, you have more blood vessels in your muscle than you had before.
Yeah.
But this is just something you're tricking the body to respond as if you did high intensity training whilst you are not.
Okay. Thank you.
There is a question in the back.
Well, two things. I'm no expert at this. In fact, I'm dangerous with this. But from what I've read, you're trying to generate enough pressure to reduce the flow back to the heart and the veins while not restricting arterial flow to the muscle. And that leads me to the next question. Another thing I read is that on the cuffs on the thighs, they were using pressures, I think, of 110 millimeters of mercury. Is the target for that pressure less than the top number of your blood pressure? Like 120 over 80 is normal? Are you trying to get close to 120 but not exceed it?
That's a good question, but these studies have used either 100 or 110. So they're more explaining it as restricting it 70% of what your 100% blood flow would be. And I guess, so you're taking away 70% of the arterial blood flow. But I guess you also, it's not that easy for the venous blood to get back to your heart. So I guess they had this pressure on for like 4 or 5 minutes, and then they let go. And then, so you have to let it take away the pressure from time to time.
So can you compare this to regular exercise? Why would you do this over regular exercise? And one of the concerns I had in the earlier slide was the amount of the point to exhaustion that you're moving, working the muscle. So my concern always was if I push too much weight, I'd be tearing muscle down that would not regrow the next day. So my exercise program has always been lighter weight, many more reps. So I need to understand that a little bit better and then compare and contrast this. I'm a little concerned about the fact that there are only a couple of these people in the country, and I'd never do this, by buying something on Amazon, do it myself.
No, I agree. I don't encourage to buy your own over Amazon. Absolutely not. And so if you do many repetitions with a lighter weight, so then you won't have, your muscle will respond as they are doing during lighter weight many repetitions. But with this type of blood flow restriction, you're putting the muscle in an ischemic condition, which will increase the metabolic stress for the muscle while you are doing the same many repetition, low weight. But it has a lower mechanical strain on the muscle, so you won't have the same muscle breakdown as you would with really high intensity. So you're tricking the muscle into thinking that you're doing really high intensity training, which many of you with IBM, that would be difficult to do. So this is a way of achieving the effects of high intensity training while doing low intensity training. Does that make sense?
A little bit. I think I understand from the stress on the muscle piece, but given, again, I go back to, given the complexity and the lack of professionals there to guide you, why would you do this over regular exercise?
Because it works better. It grows your muscle while everybody else is diminishing.
So I mean, this is one type of exercise. I'm not saying that this is going to work for everyone. Still, I mean, the evidence. We only have 2 case reports on one bigger study. So that, I mean, we need more evidence to be able to say that yes, this will work for everyone. So you can choose to do regular exercise, or you can choose to try this. Probably this will maybe give you a little better effect of the exercise than you will be able to do with the low intensity training.
Well, I think the good news here is you're working on an area of your quadriceps that with IBM break down and eventually, you know, you're in a wheelchair. But the issue is atrophy. A certain of your fibers atrophy to a point where they're not going to come back with muscle flow or whatever anything you're doing. So the good muscles that you have, this is the effect you're getting with the control of the blood. The good muscles are getting stronger. And they're growing.
Absolutely.
So if you're someone that's had the disease for 5 years, you're probably a lot better chance than someone who's had it 12 years.
Yes. And I think that goes for all types of exercise. And I think that is so important. Why? I mean, they're really trying to. It's important that this type of symptoms are acknowledged really early in a general practitioner or biophysical therapist, so you can get a diagnosis much earlier, and then the prognosis will be better because you start with exercising with much more healthy muscles. But I think in any type of exercise, it's so important that you do train your healthier muscles to try to compensate. Also work with the most effective muscles, but don't forget the other muscles that are not so effective, like the gluteus, the hamstrings, the hip abductors, and with good functioning those muscles, that will help you continue being able to walk and be functional. Yes?
I have a question, Lauren. Is this strictly for the legs, or can this be used for the arms?
Can be used for any muscle. When I went online to find pictures of this yesterday, and you know, if you just Google blood flow restricted training, you can find lots of pictures with bodybuilders. So they have strapped the cuff proximal on the arm, and they're trying to bulk muscle. So literally you can put it anywhere on your extremities.
I've had 4 blood clots in my one leg, but it's been about 10 years and I'm on blood thinners. Does that totally preclude me from doing something like this?
I can't answer that.
Okay.
You have to be screened and assessed, and you know, for your, is there a risk for you? But they're talking about, they're excluding people who have a history of embolies, for example.
Just if you, as far as that, like if there's anything irregular, even a cut, if you have a cut, like let's say you slipped and fell and you had a little scrape, they wouldn't do it that day either.
Can I just not just the muscle growth. But I mean, did it help in terms of, you know, walking or getting up or doing any of the things that we struggle with? Okay.
But like I said, he said, it's hard to get the insurance company to pay for it.
Are there any more studies that you know, like a broader study of this technique for IBM that are in the pipeline?
No. Not that I know of.
Seems like something that ought to be
Yeah.
studied
So
heavily.
this randomized control trial just came out this year, and probably when people read this, I mean, I would love to do a study like this and learn this technique and be able to use it at Karolinska. So maybe I'll be the one. I'm really enthusiastic about that. But ask you, I mean, we have to encourage the research community, and I'll talk to physical therapists and muscle physiologists about this. So I think there will be more studies, definitely.
Thank you, first of all, for bringing this forward, because I'd never heard of it before, and I'm sure there's many of us that haven't. And for those that have been through it, and you felt that there was an improvement, your muscles grew, did it last? I don't know how long ago you had it, or did you find in between your first treatments and the treatments now that you actually lost some of it? You know, does it maintain more of the time, more of the strength?
No, I don't think I lost anything, because I kept exercising every day anyway. I kept exercising.
And what was the time between your first 30 and your present time that you're doing? 6 months.
I think that's the key thing, to always exercise. And then you go into this kind of protocol. And you can like still exercise and do other things during this protocol. And then after you continue exercise. And then you might go into another. So in that way, I think if you just do this and then stop and then don't do anything, you will probably lose pretty quick. Does anyone have another? Yeah, a question?
Because that sports medicine has been doing this for a long time.
Yeah, the university,
The military first.
military's been doing it, the universities all have trained people. I mean, think of a lineman, okay? Instead of having them do crunches with 300 pounds, they can accomplish the same thing using 50 pounds. I mean, less impact, total increased muscle mass, less impact on them. It's just more efficient.
And then they know how to do it.
Unfortunately, when you live out in the area, you're the only person that has this disease. My physical therapist, when I first went to her, she goes, I had to look this up. You're the first person I ever even heard of having this. I will be going to Boston to join up a group down there so I can get some expert advice down there. I was kind of led away from doing any strength training with the circuit training, I should say, the equipment, and just to use bands, because if I did too much, I was going to get weaker. And so it sounds like that's untrue.
Yeah. So it might be true. I mean, it doesn't matter if you work out with bands or free weights or in a machine, because you can adapt the resistance in the machine as well. And I'd say, of all the patients that I've seen in the clinic, I would say that 98% respond, like tolerate training. And then there is a little, very little group of people with IBM that don't seem to tolerate training very well. So you just have to go in low, increase slowly, have your function and strength measured, and just listen to your body. As long as you feel well, continue. Because go to the gym, working machines. Because I think that fear, there was a fear in the beginning when I went into myositis research that, you know, it was polio syndrome. There is a fear that you will burn out, that you will burn out in both ends. So if you work with your muscles, they will kind of break down and die. But I think I don't think that we need to be worried about that.
So we live on the beach, but we're 90 miles from Portland, Oregon. And as far as I know, there may be 6 or 7 IBMers in the Portland vicinity, maybe 35 miles around Portland. So nobody's going to put in a system like this for 6 or 7 IBMers. But the University of Oregon is, 45 miles away south of Portland. So that's the area that we're going to be able to find somebody that.
I'll bet you can find someone that's certified and can do it. Now, if they're going to take the public in, I don't know. So far here, the universities are not taking public.
Well, there may be a private practice there of physical therapy or something.
Or you convince the athletic trainer to start his own. But I mean, the thing is, with physical therapy here, it's not just IBM that will use this technique. There's other degenerative diseases out there that they can target. I mean, this is a business opportunity. They're just missing.
Well, I think if you Google it, I mean, I just did that at the very beginning because I was not familiar with what it is. It's just, I looked at that. Is that normally, I mean, I even had done something similar to this. It gave me an idea of what it was. If you just Google it, you find the first thing is you want to be certified in it. And then it was just all the places that you can find this, because exactly as he says, it's not just for this. So yes, will someone that you work with need to understand your limitations? But I think you can probably find this at a lot of physical therapy places throughout, regardless of where you are. It may not be hundreds of people, but I think you can find someone that's going to be familiar with this type of process. It seemed that way from just Googling it. You can just come up with line after line after line of people that want your business.
Primarily for bodybuilders and that?
No, there seemed to be a lot of physical therapy.
Really?
Mm-hmm. I just did that very quickly, so I think that, I think it definitely takes some research. I would start with, my thought is when we go back home is start with a lot of the physical therapy offices around town. Just start researching into them.
University.
Yeah.
Closest university.
Times a week. Twice a week.
Just to address what you were saying there, a lot of physical therapists out there, the only known certification class is by that Johnny Owens system. Again, most of it's in the university settings. What you would want to look at, it's on the web. You can search for everybody that's been certified by Johnny Owens in your state.
That's great. And
you'll see if they're a physical therapist. I mean, I even called, I said, well, shoot, I'll just go through the course. No, he won't do that. You're going to have a professional MD, physical therapist or something. He won't let you just come sign up and take it. The machine costs $5,000. It monitors the blood flow and the return flow. My physical therapist group was too cheap to buy that, so they bought some inclusion cuffs, and I guess they wing it. I'm a little concerned you were using 110 millimeter pressure. I'm pretty sure they're using 200, 250 on me. But she assured me the cuffs they were using would not occlude the vein. Okay.
It didn't.
No, it didn't, and it worked fine, but you do want to find someone that is certified and knows what they're doing first, is all I'm saying. Insurance, I agree with the gentleman back here, is a major issue. I mean, basically I stopped when my Medicare ran out. But court, who I was using, has a program that for $20 a month, you can go in anytime you want and use their equipment as much as you want for $20 a month. And they will pump it up for you and set the pressures and help you. Huh?
Who did you say? You said somebody had $20 a month.
Court, physical therapy here in Kentucky. K-O-R-T. K-O-R-T. But I think they're only here in Kentucky. I'm not sure they're anywhere else.
But you're saying they had this equipment?
They have an inclusion cuff and a way to pump it up. They didn't buy the Johnny Owen system, which I'd much prefer if they did. But I recommend highly. I bet they would. Like I said, there's 2 groups in Kentucky, Bluegrass Orthopedics out of Lexington and Court Physical Therapy. They only have 2 physical therapists in the whole state that are certified. They're working on it. But you do want to get someone who knows what they're doing. I mean, you want to be very specific to the muscles that you're going to work on and not be out there just winging it. So yes, you want to make sure they're certified and they know what they're doing.
And just as a buyer beware, when you're looking at certification, was it an online, I'm going to watch a video for 2 hours and get a certificate versus like a legit certification program? So something else just to kind of keep in mind too is, anybody can get a piece of paper and put, BFR on it. So that would be the other piece of making sure that you're doing your due diligence and you're researching that sort of thing.
So what is the danger?
What
are we afraid of here?
Well, I think if you're taking away, you're strapping out this cuff, and what if you have a risk of an embolism or a blood clot? So that is the risk of, and so there is a risk that maybe if you have a blood clot sticking somewhere, it might lose when you put the blood flow on again. So there is those risks. So you need to know that you don't have a history of that or a risk for an embolism or blood clot. You need to know that your vessels are pretty healthy.
Yeah, because if you have plaque in even an artery,
Yeah.
you can break that loose, and that can not be.
It can get stuck in your lung or in your brain.
Yeah, or go to your heart.
Resulting in a heart attack or a stroke.
In our case, it was issued by a prescription by the doctor with specific, to work on these specific muscles. So it's dose related and specifically to wear. And if it's not done for you that way, then it's not being done right. You don't want the physical therapist to figure out what he's supposed to do or she's supposed to do for you. You want your doctor to be intelligent enough that he's going to prescribe it correctly, like any medication.
Just put your mind at ease a little bit about the 200 millimeters of mercury. Usually in orthopedic surgery, for when we do surgery on hands, there's a lot of surgeons, and the set standard is like 250 millimeters of mercury, and we can keep it on for a maximum of 2 hours without, and longer than that. The higher the pressure, the higher the chances, the higher the pressure, the longer the time, the higher your chances are of having some ischemic tissue that doesn't recover or nerve injury and things like that. So that 100 to 110 is actually a very low setting. You figure when they take your blood pressure, oftentimes it's going up to 180 millimeters of mercury or even more depending on what it is. But I said standard orthopedics, it's not unusual to do 250 millimeters of mercury.
We have 1 minute left. Is there a burning question or comment?
So are you going to do a clinical trial?
Now I have to, right?
Well, I'm from Sweden.
Yeah.
I was planning to go there.
Thank you.
Hooray for the group TMA. It's the Myositis Association, helping patients become peers now for the past 25 years. So if you have been diagnosed, here's an organization to unite us. 8,000 members they can boast. For that real strange word that no one's heard, it's myositis. There's an annual patient conference which is just second to none, where you'll learn a lot and network, and you'll also have some fun. And their website is updated with a lot of current news, with lots of info and resources, and much more that you can use, like info TMA compiles, and like lists of clinical trials, and lists of research too. You can review, cause it's all there for you. So hooray for the group TMA. It's the Myositis Association, helping patients become peers now for the past 25 years. So if you have been diagnosed, here's an organization to unite us. A quarter century they can boast. They've been the group that's got the scoop on myositis.